Welcome to the Remarkable Dentist Podcast with me, Fred Joyal, where I interview amazing dental practice owners digging into their successes and failures, their insights and hindsights, getting their views on where dentistry is going, and discovering what it took for them to become remarkable. Welcome to the Remarkable Dentist Podcast. My guest today is Dr. Andrew Matta, who is the Chief Medical Officer and also the co-founder of North American Dental Group, which has over 260 practices in the U.S. and is also about to have a whole group join them in Europe. So we've got some interesting things to find out from Dr. Matta. He's a good friend of mine. We go back a long way in the industry. I've always found him to be very insightful and thoughtful, and has executed really wonderfully in the DSO world. So without further ado, welcome to the show, Dr. Matta.
Thanks, Fred. And as you said, we go back a ways, and I've always really admired and respected what you've done in the industry as a whole, beyond DSOs, just the entire industry. And you've always been innovative for us. So thank you for all that.
So how long have you been, when did you get out of dental school? Let's go all the way back.
So 2004, I went to the University of Pittsburgh School of Dental Medicine and graduated in 2004.
And did you associate for a while, and or did you
actually no? I
start a place?
1 year of a residency, and during that point, I knew I wanted to come out running. So was talking to practices and was fortunate to find an opportunity for a private practice, which I bought pretty much while I was in the residency. And that way, as soon as I transitioned and graduated out of the GPR, I was able to jump right into practice ownership. And in the first couple of years, really just concentrated and focused on making the most of that opportunity, growing that single practice location. The owner stayed on for, I would say, about a year or so as a partial partner, and then bought the rest of them out shortly after that. And then along the way, in the first 3-4 years, purchased a couple more locations, and then eventually merged them all together into one larger practice. So that was kind of my initial steps towards having more of a group. Started to have associates in that larger practice, and then started to think about multi-site. And
so this was pretty quickly, this was happening. You started owning. So you weren't daunted by the idea of ownership. Did you find it daunting after you started?
It was certainly consuming after. It became, a 24/7 endeavor. But no, I did have that ambition, even while I was in dental school, to just have an entrepreneurial aspect to it, to have a business aspect. But you know what, the word daunting might be the right word actually, versus there's a lot of hats you're wearing when you're the practice owner, especially if which dentists are, you're wearing a clinical hat, which consumes a lot of your time. So trying to learn the business, run the business, expand the business, all of the different nuances, legal, accounting becomes challenging. So I would say, about 5 years in, when I was really starting to lay into a multi-site plan, is when things started to hit a new trajectory. I met my now co-founding partner, but Ken Cooper had a management service organization. We didn't call it a DSO at that time, but he was providing effectively all of the administrative and management services for practices that he partnered with a few other dentists in at the time in that same period. And we met in early 2010 and quickly aligned values, shared business plans, had a lot of what each other were looking for. He had a finance expertise, understood capital, understood how to grow and scale from some of those business principles. And I was bringing forward some clinical philosophies that I really wanted to have at the heart of of any group at that time, the foundation. So we partnered together in 2010, and that was the first makings of North American Dental Group.
So as we know, every DSO functions a little differently and sometimes completely differently.
Yeah.
At what point did you realize you needed some money, some big money?
Day one, I would say, because of the business plan itself. I think if we would have had a vision to take it slow, then you could use the income from, practice A and use that to fund purchase, or we don't call it purchase, but affiliation, partnership of practice 2, 3, 4. And I think it really depends on your business plan and your scale and the trajectory that you're looking to have. And so for us, capital was right at the beginning, because we had a ambition to become multi-site, multi-location. We started in as a partnership model right from the get-go, in which we wanted to find practices. The first phase was probably the typical. You might have an exit strategy or a succession plan opportunity for a dentist and give them a vision of being able to, be somewhat of a late career decision for themselves. But we quickly shifted towards wanting to have more engaged partners, individuals at an earlier phase in their career that would retain equity into the organization when they brought their practice in and truly be a partner in the company. But regardless of the first setups, each one of those required capital. So money was something that you had to really have a good, clear plan for right from the get-go. And you quickly learned that traditional banks, local banks can fund things, but that you quickly hit a bit of a hurdle with those because they have very traditional parameters, recourse. You're signing personally on each one of those situations. And it becomes hard to really build a scalable business with that. So then you start thinking about other types of capital raises with different types of banking or equity models or private equity, et cetera.
Yeah. So definitely if you go the banking route or the combination cash flow and banking route, the pace of growth, if you're actually looking at a true DSO, which is going to be 5, 10, 15, 20, 100, 200 practices, you're going to need backing. And you mentioned something that I think a lot of dentists are curious about. I don't think a lot of them understand the structure of a deal. One, the DSO doesn't really own the practice, doesn't own the patients. That's almost never allowed in most states. And so it's created in a separate structure that the practice is owned by dentists. Now it could be the dentist that you bought the practice from, right? Or it could be a separate company that has a dentist that is affiliated with you that has an agreement with the DSO to manage these practices.
That's spot on. The DSO is the business entity. That business entity is providing non-clinical support, all of the administrative, the business functions, the finance support, payroll, accounting, HR, legal, all of those things that are non-clinical. And the practice entity, the goodwill, the patient relationships, and every DSO may set it up differently, but for us, everything that happens inside of that four walls of a dental practice, those employees, those are aspects of the clinical aspects of the practice. Those are the professional side, the clinical side of the entity. So really you have two companies that have agreed to certain services that each would provide. Really, it's a support system, and we call it, the vernacular that we use is our DSO. We call it our resource center, and the resources that are provided are all of those administrative functions, marketing functions, some of those elements that can help with patient connection and all of those things. And then in our world, North American Dental Group, that's our DSO. That's our support system. That's kind of the umbrella brand that we use. But internally, we have our professional corporation called the Professional Dental Alliance. That's where our clinical ownership sits. That's where the doctors, they truly own the company that then contracts with the DSO. And the doctors own that Professional Dental Alliance. And then from there, what is fairly unique to us, we really have a lot of uniformity and collaboration that happens inside of that professional group. That's where the doctors develop philosophies, they develop our intake plans, they develop our care models, and the processes that we have agreed upon as clinicians, that we want all our patients to have as similar experience as possible, as high a standard as possible. So that happens here. But then you have to execute on that. So that's where we lean on the operation and the business to support us in executing on a clinical vision that we want to achieve.
At what point did you reach like a plateau where it became a different business? And there's probably, you're up to 260 practices in the US. We're going to get to the European thing in a few minutes. What were the stages where you went like, wow, this is a whole different business now?
Yeah, there's a couple milestones, and you read about them in certain books, and you talk about, certain great business books like Good to Great and things like that. You start to think about, what are these milestones? And I personally kind of connect them to certain growing pains. And I think the first time we really felt that scale difficulty was at about 50 practices. Of course, getting to that had all of the obvious challenges, but when we got to 50 practices, that was the first sign, 50 to 75, maybe 75 to 100 at the most, where you couldn't touch it all. You couldn't have relationships with every practice. You couldn't visit every practice in the same way. The relationships that we had in the early days, we're able to be on the road. We have personal relationships with. You
knew everybody pretty much at that point. Yeah.
When you start to get beyond that, that was the first time where we really had to look at our group differently and talk about how are we going to scale our culture through other leaders in the organization, not just department heads, but true engaged leaders. And that was probably where it was at the same time that we did our first multi-site partnership. So this was an individual in Toledo, had already had 6 locations. And instead of looking kind of at a single practice at a time, when we brought that in, you could tell that they already had a community. They already had leadership. Dr. Choksi was young and ambitious, and his group identified themselves as a group. And from then forward, we really started to partner with other small multi-site groups. And that has become more of our culture. Is we have grown through individuals that are also entrepreneurial, that align with our value system, et cetera, all of the things that are important to us. Our culture is really the key of our company. And when we find individuals that connect with us on that, it's really helped us to scale, because essentially you're bringing individuals and empowering them to continue to lead that group, but within our bigger ecosystem. So now we have what we call our group founders, and we have over 35 of those individuals that had 3, 5, 10 locations. And they come in and partner with us and take the journey as a part of a broader community.
So that was a real accelerant to start grabbing practices, adding practices to North American that were already rolling with multiples, because it's almost the same amount of effort, isn't it, to buy, to affiliate with 5 practices at once in one bundle versus one, maybe faster, because the doc is a business person at this point. he or she's worked out a lot of stuff already about that.
The culture should already be a certain way, right? They're already thinking, in a community sense, they're thinking as a group, they understand process, uniformity. But that individual might be hitting the same challenges that you started with capital, right? So that's a typical, I'm ambitious to grow my local brand. We have a brand in Columbus in Central Ohio called Stone Creek. That individual came in with, around 10 locations. You have different reasons or different things that they come in, but rather than reinventing the wheel, scaling a central support system, scaling we call it a patient service center, but a call center for new patients, any of those things, they can now step into something that's already built, and they can continue to grow their brand or their group in their community, which they know much better than we would, right? That individual knows Central Ohio, far better than we could. We could just provide additional data, additional support, additional resources, and for sure the capital, to kind of come in and allow them to continue to grow. So there's two, you scale more because you're bringing in groups, and that's, like you said, rather than integrating one practice, you have the same set of resources doing a community of practices. And two, you're empowering them to continue on their journey. So it creates that if 10 groups are all adding 1 to 2 locations a year, you're growing that way, plus partnering with other groups.
Wow. Yeah. I'm wrapping my head around that because it's a twofold way of increasing, because it's like cells multiplying. They are, you didn't just acquire a practice, you acquired a group of practices that knows how to grow itself already. Maybe at a practice every year or two, or maybe they're at a year or two and you take them down to every year, because now you've provided the capital and you've wrapped all these things around them. Because typically, like, by the time you're at 5 practices, you're going, I need a central call center. I need to centralize. You need to start to centralize everything. It's chaos, right? Because you're still in all these individual places and you haven't consolidated all of the activities yet. Now, all of a sudden, North American comes along, consolidates everything, and away they go. Now that a lot of the hard part's done, and they just go, well, I know exactly the next practice I want. And you say, well, go get it.
And that's exactly what you scale is the hardest thing there, is you scale leadership, because you already have passionate, engaged leaders that really, dentists are great entrepreneurs. They are passionate about what they do. It's a unique industry, and where you have very successful individuals that have, learned the key elements. And the biggest of them all is the cultural leadership. So what I said at the beginning, where you stop having the ability to put your hands around each location and do that, well, now you have individuals that are engaged, they're passionate about their brand. And then what you look for is ongoing passion about the broader NADG brand, being like-minded. We have a number of programs that start to try to create a community of culture around, the similar philosophies. But there's incredible alignment that you find among successful dentists. So if you start to get, similar personality and culture, it just allows you to scale the hardest thing of all, which is leadership. And you then empower them. And this is something we spend a ton of time on, is what is that balance between empowering them, giving them the reins to continue growing and doing what they know and what they do best, and versus kind of just, you don't want to top down the situation. You don't want all of a sudden, hey, you need to now change everything about what you are doing. It's a delicate balance between doing things as a community, but at the same time, giving them that local personality.
Yeah, it's very interesting, because a lot of DSOs that have the challenge is that they come in and they change a lot of stuff, or the dentist is downshifted in his mind to an associate level. Exactly. And he's abdicated leadership and maybe is happy about doing it, or is kind of unhappy about doing it, but he didn't realize he was going to be unhappy about doing it. And I'm all about the patient experience, which is all driven by the patient culture. So I'm more than a culture advocate. I'm hardcore about it, and it's those driving principles. And it is something that, that my favorite expression about is culture is what your people do when you're not looking.
That's a great, I'm going to write that down as we speak. Yeah. Because, you hit the nail on the head, that you need alignment. If you are taking on an individual and they've become, okay, I was a leader, I was the owner of this, now I'm an employee, that's a different mindset of an individual. Maybe that's welcomed. I think that, in our first days, that is what we did, candidly. Our first were buyouts where the individual may retire and you bring in someone else. And it just seemed like we were hitting our head against a wall, and it was a bit of insanity. When we shifted towards those individuals immediately being a partner. So if their practice had a certain value, they took part of that value and became a partner in the entire company, not just at their site. That immediately starts to create this community of alignment. We're all rowing in the same canoe. We're all doing, things to benefit the greater good, rising tides, all of those things that really do make a difference. And they're not an employee, they're a partner. We have, like I said, we have 35 or so what we call our group founder partners. But then now we have extended it to say, every doctor in our company, we want to give an expectation and opportunity for them to be partner. And now we have over 150 of our doctors that are partners, individuals that were associates that otherwise may have wanted to have some sort of ownership. They now see a path of being a partner in something that's unique. So that alignment is there across our doctor community. And it's much different what you see as soon as they even just shift themselves of thinking, okay, I'm not going to be an employee, or I was an employee, now I'm a partner. And right out of the gates, those individuals that came in, they become an engaged partner versus, like you said, shift to an employee.
So you don't build practices. You don't do de novos generally, but maybe your subgroups do.
That's exactly right. We do de novos by empowering those that came in and grew from de novo to continue to do de novos. So yes,
I am loving this model, man. It's just brilliant.
So a great example is our partners in Atlanta. They grew 14 practices via de novo. When they came in, they understand that system. Right. So we continue to empower them to build new de novos in that market. And then you start to get idea sharing of, there's another group, the one I mentioned in Toledo is a great example. They've built from de novos. They start to idea share and start, oh, wow, I didn't think of that. I didn't think of this. So we create these events where we idea share, et cetera. So it just enhances them. So that way we don't have to invent this de novo machine centrally. We empower those that know their community. And then just back them with additional resources. Something like when we use Buxton as really key information about demographic analytics that can really help them. So when they feel like, hey, I was kind of going off my gut that this would be a location that is good for my next practice. Now I've got all of this data and all of this really great information to either validate what I was thinking or make me pause and look at something else. So
what's the mean income? Is the population growing or shrinking? Is it becoming more affluent? Is it gentrifying or is it shrinking? Right. What's the traffic flow in the area? All of those things. That's when a lot of dentists don't even know how to tap into all of that stuff. When they go, well, I live in the area, I think this is good. And they sit in the Starbucks for a couple of days and try to figure out if the traffic is right for the location. And it's, it's a little ad hoc, rather than data.
But you find that it's actually quite interesting how those gut feelings actually end up being a great place for us to start. What we end up doing is validating more than we discount, or end up saying, hey, this is going to be a misstep if we go here. You end up seeing that sixth sense that an entrepreneur has about maybe a location selection or the patient experience, all of those things. you end up finding that you're validating their notion more than redirecting.
Yeah, well, and they live there. It is their hood. So they have a sense of it it's not just a gut. It's informed by living there. Whereas if you were trying to be a DSO that just said, look, we're all Denovos, we're just going to pick places to put it. It would be much harder for you to walk into Toledo and be right most of the time.
Exactly.
Because you're just going by the data. The data is one thing, right? So,
and data is powerful. And sometimes you can put a little too much stock in the data. When it comes down to it, you get somebody that's, like you said, local, your community. And on top of that, you also can help. It's an easier process towards building that first team in that office. You can take somebody, maybe that you have 2-3 doctors in a practice and one's an emerging star. You can give them the ability to jump into that new site and take it for them and build a team around a doctor that's already had success in the community.
Yeah. Well, I was just talking to some dentists and I was helping them with their SEO on their website. And I had a software that showed me where they rated strong and where they rated weekly and came up 7th, 8th, 9th, 10th in the search. And it was like split down the middle. And I said, clearly there's some delineation. And they went, oh yeah, I-35 runs down the middle. People, they do business on one side or the other. Now, somebody from the outside would come in and say, I found this great location on the wrong side of I-35. They got a great deal on it. I'm going to pull from all these fabulous neighborhoods east of the highway, and then starve, right? Because the data told them the radius looked great, So
it's a great example.
So let's go back a little bit. What surprised you about dentistry when you got into it?
That's a good question. And I'll probably go down a bit of a rabbit hole that's become somewhat of a passion of mine over the last couple of years. I don't want to say it surprised me, but I think the magnitude surprised me. I knew that dentistry was its own industry within healthcare, but the amount of disconnect between dentistry and other parts of medicine, I think it's a really distinct division. Dentists are not used to communicating with primary care or with ENT or with cardiology. The health systems are vastly different. So again, that's not a surprise. Dental insurance and healthcare insurance, medical insurance are completely opposite almost. One pays until a max and the other has a deductible until you hit a point and then it pays, They're opposite in every form.
You got a catastrophic problem in dentistry, you got a catastrophic problem.
That's exactly right.
And you got a catastrophic problem in healthcare, $1 million is going
that's
through
where you're
you
covered.
Right to the hospital.
And that's exactly it. So they're opposites in their health systems. And then the communication barriers are there. So I would say what surprises me is how divided we are, and that fragmented system, I think, is a challenge to really advancing patient health. And that's, I think, it's going to be, fortunately, I think we're coming to we've had awareness of periodontal disease affects cardiac health. We've had more data that shows perio affects this, et cetera, and vice versa. Diabetes affects perio, and perio.
It's like almost every 2 months they go, there's another disease that is affected by periodontal disease. It's like, why is this a shock? Why do you not see the mouth as part of the body? It's like you took anatomy in med school, right? It shouldn't be disturbing that hole in the face that actually accesses everything, is influences your health. But
inflammation is at the core of all of it. That's what is such a driver in patient wellness. So I think that we're at that tipping point inside of dentistry to shift towards a different sector or different mindset. There's going to be natural resistance, maybe not overt resistance because no one disagrees with it, but it's just our comfort zone is we're not used to thinking about CPT codes. We're not used to thinking about electronic health records that communicate with physicians. So I would say what surprises me is that mindset from a clinical perspective. And I think in the next 10 years, we're going to see just a lot of innovation in that way in terms of bridging. And it's what I'm trying to spend most of my time is really thinking differently for our group.
Yeah, I think that there's a lot that people are going to find out that, for example, the ability to do what you can diagnose from breath and saliva in the whole body is phenomenal. And if you're, and a lot of it can just be simple instrumentation that measures this stuff every time somebody comes in from a prophy. So it's not just like oral cancer screening anymore. It's like, hey, we've got all of these things we're finding out about you and we're tracking it. And hey, let's aggregate the data. Eventually, let's aggregate everybody's DNA, and exactly. All of their symptoms. Let's learn who is prone to various diseases by their DNA. I think that there's going to be a great opportunity. I also think COVID sort of accelerated this concept, this joining of overall health and oral health, because people started thinking a lot more about their immune systems. And if we can sort of seize that opportunity and say, guess what? This is the cornerstone of your immune system is your oral health. I think we could really advance it.
Spotlight on the scope of service of the dentist. When we had individuals and we wanted to test our employees, or when dentists a year ago today was when we had 85% of our locations closed and sending other patients to, other offices in the region and funneled our emergency care into about 50 of our practices. And you wanted to use the other dentists to be able to do diagnostic tests and COVID tests. And that was like a key discussion point. And these are health professionals. And we were also asking the question, can they do a COVID test? And it just is like absurd to even wonder, it's such an easy test. Can a dentist use a cotton swab in the nasopharyngeal area? Is just, it's something that we shouldn't be asking that question. And it's a dated
or should dentists be allowed to do vaccines? It's like,
and that's exactly
I would much rather let a dentist give me a shot than a doctor.
and those are the questions that you get. So it put a huge spotlight on this, this question mark. And you just realize, we're really fragmented from a health system for whatever reasons. I think that we were built in a private practice setting where repairing a tooth was the main service that you provided. And now it's evolved considerably, even how we're educated as dentists alongside medical students in many institutions, et cetera. So it's just evolved, but I think the rest of the dynamic needs to evolve too.
Well, and there's such a bizarro mindset among so many people. I remember when we put it out there that dentists should be doing vaccines. There were people that were like, that's insane. What, like really? But it goes all the way back to this whole thing about the way they take care of their mouth and the rest of their body is very different. Right. It's like, if they broke their finger, they wouldn't chop it off. But if they have a bad tooth, they go, well, I'll just pull it. Right. I'm just going to get it pulled. It's like, why is that a sensible thing to do? But it's like, there's just a completely different way that a whole bunch of people look at their teeth. That's disconnected. It is a full-on dichotomy between their health and their mouth. So Anyway, we could go down. We've gone down the rabbit hole pretty far, but let's talk about this European venture that you've got going on.
So this is actually,
if you know, within the, so.
Yeah, I mean, this is moving, it's already in consolidation, so we have a partner in 2019. You talked about capital early on. So we had a private equity partner, and then the new partner that we brought in, for capital is Jacobs Holding. They're actually a very interesting organization because they actually exist. They're a family holdings company that exists to support the Jacobs Foundation, which is a massive research and foundation globally that have existed for number of reasons, but mostly for youth development and research around children, and they're based out of Switzerland. They had already been assembling assets in Europe for dental groups. And they had looked to us as a opportunity on this side. And when we partnered with them in October of 19, the vision was to start to bring everything together over time. So we're in those early phases. That name of the dental group there is called Coliseum Dental. They're in 9 countries in Switzerland and England, Sweden, France, et cetera. And we've been collaborating with them. Of course, right when we had partnered with Jacobs Holding, we then entered into the pandemic. So the last year has shifted things a bit, but we did really learn from each other. And it was actually very fortunate to go through this pandemic with partners in Europe because we're experiencing things at different times. And we got to have, daily calls as to what they were going through. It really gave us a heads up. In early March, we started to really have awareness that we weren't going to avoid, this COVID virus that was starting to diffuse throughout different countries from Italy to others. So it is really interesting. We are in the final stages of forming our first global medical board. We've had some advisory panels and things like that, but now we're intimately forming that global medical board. That's going to be the first thing that hopefully continues to drive the philosophy of the consolidated group.
Fascinating.
Yeah, so it's really interesting.
They have more practices than you right now, but so you're going to more than double the size of the group, which was exciting. But this is what can happen when private equity of a certain size gets involved. Their reach is further. They are more involved in bigger deals than you would be exposed to if you had 5 or 10 or 15 practices. And
it really starts to create a whole different mindset. We in the United States think according to our regulations, we have amazing things that we're doing in the US, but there's also some amazing things that are happening. And, there's from a regulatory environment, you see some standards such as waterline decontamination and things like that we are having here in the US, but it's been in place for over a decade in some countries. So, you realize that there's some elements of the industry where we're far ahead of the game and others where certain countries that on that side is ahead of the game. So the international component has been really educational.
So I have 2 questions. I'll ask the first one. What would you tell a dentist coming out of school right now? What would you recommend to her?
So I would say first and foremost, work to grow your patient care, your patient experience. Dental school provides you a foundation of learning and knowledge, but then it's kind of like, okay, now you're at the starting line. So the first, 5 years, the first 10,000 patient encounters, there's a lot of learning in that period of time. So immerse yourself in a system, and it's not just promoting DSOs, there's private practices, there's great educational institutions that really support dentists. The first 5 years, I got that advice. And even though I had business ambitions, I really enjoyed dentistry and invested a lot of time in learning. And I think that if you are a new dentist, as much as you have gone through a lot of hoops and invested time and money and all of the stuff that you want to now be, done and ready for action, there's a lot to learn in the first years as a clinician. And the more you immerse yourself in your 1s through 5, the better the rest of your entire career will be. And it doesn't mean you have to do advanced cases and complex cases, but we do need to be master clinicians at diagnosis, at guiding our patients towards what's best for them, and making sure that you can be the center point for your patient experience. So there's just a lot to learn, and find a practice, a system, an organization that will invest and support you in that effort.
Yeah, you need to work alongside somebody who has the communication skills and the workflow skills, like how you move through a practice is either highly efficient all the way down to grossly inefficient. And the difference is how much you produce every day. But, you know, your communication skills and the environment you create is all case acceptance. And it's not the difference of a point or percentage point or two. It's 10, 20, 30% more acceptance.
It's exactly, you know, the outcome will be good medicine is always good business. And at NADG, we were delivering a presentation yesterday to a larger community of you know, non-DSOs. They were smaller groups. But we presented our training platform. And when we were preparing this, it was really neat to see, because you kind of build things as you go and you evolve different things. But when you put it all together and saw how much we are investing in our clinicians and our team members, you know, a new doctor for us spends, you know, 6 days in what we call doctor infusion, which is that immersion. It's the fundamentals. And then they go into what you just talked about, that hand-to-hand mentoring we call clinical advancement club. So it's, you know, virtual connectings, but also partnering with your mentor and making sure that your next 90 days have intense mentorship and hands-on support. And then there's like, you know, non-clinical training in terms of culture and leadership and communications strengths and being able to lead a morning huddle and things that dentists don't come out thinking about. Like, how, you're a leader in your office, whether you signed up for that title or not. When you graduate and you're the doctor, you have an expectation to be a good leader. So, you know, we invest in a lot of non-clinical training to pair with the clinical training. So when you start to look at it all, it's amazing. And we never came out and said, hey, we have to train on all of these elements. We just kept adding, hey, they should get this and they should get that. And I think it's a difference. You know, you have to have those support systems in place in the training.
Yeah. Otherwise you are reinventing it yourself or not learning it, not developing it, because at the same time you're trying to get faster with your hands and deal with all of the clinical aspects of it and the clinical advancements. It's hard enough to keep up with the changes in technology now. It's a very different profession than it was when I first came involved. There was technological advances were slow and rare, and now it's like, wow, you're still doing what? You're still taking impressions, you know, using impression material. These are big things that are happening, and it's exciting, but you know, you've got to become a great leader, an effective business person, and continue to become an educated and re-educated
clinician. And dentists aren't used to the other element of the fragmentation is they're not used to talking to other dentists that might be just down the road from them. And even within a group, sometimes the dentists aren't working together. You know, they may work with the people that might be in the same four walls, but outside those four walls, it's just like, well, how do we collaborate? And do I go over this case with them or not? And that's the other area we've tried to invest in, is making sure that there are ways that our doctors are actually working together, that our specialists are supporting each other and the dentists. So dentists don't only fragment themselves from other parts of healthcare, they fragment themselves from each other. So that's the other part of creating community.
And so where do you think dentistry is going if you had a quick vision for it?
That's a really good question. I would say where dentistry is, you know, you're a real proponent of the patient experience. Your books speak to it. You've built models to try to improve doctors in terms of welcoming a patient. So I would say it always goes where the patient drives it. And we say that, you know, before you have the right to call an individual patient, you first have to win them as a customer. So really what's going to drive the industry is the customer. As much as we want to say that we're healthcare, et cetera, and we know what's best, the truth is I believe that the individuals, the customers will drive things. So things will happen more that we will have to figure out virtual and telehealth. You really have to get your patients in the way they want to be in. Their experience, they will innovate and they will evolve, and we will always be catching up to where they're going to drive us. That's where I think the healthcare and dentistry will come together. It makes sense because we see our patients more touch points than they see their physician, especially in the years where they are mostly well, right? Where they don't have chronic illness.
Absolutely. Yeah.
So we have an opportunity to decrease complexity and cost doing fundamental diagnostics and create touch points with their primary care. There's a lot of opportunities there, but where it's going, it will be dictated by the customers, that we're in a service industry and they will guide this.
That's great insight and good advice for the young dentist as well. Well, Andrew, thank you so much for your time. This is a truly remarkable story, and it's exciting to me to hear the depth with which you've evolved your business and the directions that it's gone in. And I can't wait to see what's next for you. So thank you very much for your time, and we'll check in and see later on and see what's going on next for you.
Awesome. Well, thanks for having me on your podcast, and always a fan of what you get involved with. You're a real innovator for our industry. So thank you.
Thank you, Andrew. So everyone out there, I hope this was valuable to you. If it was, subscribe to the podcast, share it, tell your friends. In the meantime, keep on becoming remarkable.